So good morning everyone, I'm Norhaifa P. Makadema. So I was assigned to discuss the condition hyperaldosteronism. So before I discuss, let me tell you about the disclosure or the disclaimer. So information in this presentation should not be relied upon for the diagnosing and or treating of a medical condition. So resources referenced do not constitute an endorsement, nor are these resources exhaustive. So nothing is implied by inclusion or when a resource is not referenced. So the learning objectives. So at the end of 10 minutes, participants will be able to first understand the meaning of hyperaldosteronism. Second is to learn about how to evaluate a patient with hyperaldosteronism. A third is understand the prevalence and diagnostic studies for patients with hyperaldosteronism and be able to identify screening and treatment options for patients with hyperaldosteronism. So what is hyperaldosteronism? So aldosterone is a steroid hormone made in the outer part of your adrenal glands. So this hormone helps your body maintain the right levels of fluid and sodium in your body and get rid of extra potassium. So too much aldosterone is called hyperaldosteronism. So this extra aldosterone causes high blood pressure and low potassium levels. So sometimes it can look like moderate to severe high blood pressure and go undiagnosed for a very long time. So next is the causes of hyperaldosteronism. So there are two types of it. So first is the primary. So this is caused when the adrenal gland makes too much aldosterone hormone, and there are several reasons for this. And the most common one is a non-cancerous tumor called an adenoma on one gland. So other causes include the following. So first is the bilateral adrenal hyperplasia or growth on each adrenal gland, a tumor outside the adrenal glands that release aldosterone, a cancerous tumor that releases aldosterone, and a genetic disease called familial hyperaldosteronism type 1. So this condition is also called Conn's syndrome. So next is the secondary hyperaldosteronism. So this type is caused by another problem in the body that results in too much aldosterone hormone. So this isn't due to a problem with the adrenal gland. So the causes of it include the following. So first is a tumor that makes renin, heart failure, pregnancy, chronic liver disease, renal artery stenosis or narrowing of kidney and arteries, loss of fluids, and shock. So next is the symptoms of hyperaldosteronism. So the most common sign of it is high blood pressure. So it is usually hard to control and treat and doesn't respond to medicine, and sometimes people who have this condition take 4 or more types of blood pressure pills which don't seem to help. So high blood pressure can cause other symptoms include the following: the headaches, dizziness, blurry vision, and heart problems. So this condition can also cause low potassium, and not enough potassium can cause problems, especially with your muscles. So symptoms include the following. So first is numbness, tingling, temporary paralysis, weak muscles, and cramps. So because aldosterone manages your fluids and electrolytes, you might also experience the following. So first is peeing more often, waking up often to pee, being very thirsty, feeling weak and dizzy, and some people who have this condition don't have any symptoms or asymptomatics. So next is the test for hyperaldosteronism. So first is the blood test. So your doctor will do blood tests to check your potassium aldosterone and renin levels. So low potassium and high aldosterone can mean primary hyperaldosteronism, while high renin can mean secondary. So next is the urine test. So these tests are done over 24 hours to check if there is too much potassium in your pee. However, some doctors feel these tests aren't the best way to diagnose this condition. So next is saline infusion. So your doctor will give you a sodium tablet over 3 days and then test the amount of aldosterone in your urine. So this can also be done with intravenous saline over 4 hours, followed by a urine test. So next is the imaging test. So tests like computed tomography or CT scans are used for primary hyperaldosteronism. So your doctor will use these to look for tumors and growths that can cause adrenal problems. So next test is the adrenal vein sampling. So your doctor may use this test if the imaging tests aren't very clear. So this is usually done to find out if the problem affects one or both adrenal glands, and it is also done before surgery. So the next is the genetic testing. So this test look at your genes. If you are younger than 20 years old and have a family history of this condition, then your doctor might order genetic testing. So next is the treatments for hyperaldosteronism. So first is the surgery. So your doctor will usually recommend laparoscopic surgery for tumors or growths that are only on one adrenal gland. So having laparoscopic surgery means a shorter hospital stay and quicker recovery. So next is medication. So if there are growths on both adrenal glands, your doctor will give you diuretic medications like spironolactone or eplerenone. So you may also receive aldosterone blocking medications, and these don't fix the problem but help manage the effects. And then also other conditions. So for secondary hyperaldosteronism, your doctor will treat the underlying health problem. So this is usually done with medications. And lastly is the lifestyle changes. So you might also have to make some lifestyle changes, especially if you have high blood pressure. So first, avoiding alcohol, stopping smoking, exercise, weight loss, and low sodium diet. And that's all for my report. Thank you for watching.